when you step back, you really have to understand there's so many moving parts potentially when you do lateral position. This product just helps kind of speed that whole process along. It goes back to patient safety and quality for patients at the end of the day, and that's what the product provides. You can lateral position someone very safely in 60 seconds, that unheard of before. So I think it does create this efficiency that's better than anything else I've seen or used. So I think it's an important kind of point to remember with this lap pack, because I think it provides that stability through any range of motion that you might put the patient in any procedure, whether you're lateral or even supine position. I think one of the things you have to remember as you start flexing the bed, you are changing the pressure points. And depending on how you initially started that case or how you padded things, some of those pressure points might change. It adds that layer of comfort for the patient, safety. All the pressure points are protected. Those patients on the pad are very secure. Everything we do to improve patients' experience and improve the efficiency of their recovery is multifaceted. And this is another tool we should be utilizing or looking at. Intraoperative positioning is just as important. Whenever I see something that's innovative and helpful for really patient outcomes and the quality of care we provide, then I'm interested. I was trained a certain way, but I think there is a better way of doing it now. And we have products that are able to do it better than what we had in the past. And it's easily reproducible. Time efficient, and again, it provides a quality and a patient safety. There's actually a patient, there's a mother, there's a father, there's a grandfather that is in that position that you need to take care of, not only from a procedure standpoint, but really the pre-op and then their post-op recovery is all dependent how they are positioned in the OR. Pink Lap Pack is just another advancement that helps my patients, recovery. I know I'm providing them a safe situation during the procedure, and that just adds to their post-operative recovery to minimize any complications that might occur from positioning. So I think having new technologies, I'm always open to new technologies. We got to keep moving forward. We can't look back, and we don't want to stay stagnant. So there's always room for advancement.